organizations, National Commission for Women Now, and Black Women's Blueprint have come together to create a space where our intersectional and radical feminism can live in action. We hope that this series will help our organization solidify the priorities of a feminist agenda in the first 100 days of the Biden-Harris administration.
Absolutely. Now, before we get started with our program, we wanted to invite you, if you haven't done so already, to let us know in the chat box your name, where you're joining us from. I'll do the same. I'm Farah Tanis, as Christian already said. It introduced me as I was introduced earlier in the slides. I'm Farah Tanis. I'm one of the co-founders and co-executive director of Black Women's Blueprint. Who are you? Please let us know. We're honored to have you here. Put your name in the chat. I see that some of you have already been communicating with us. Where are you joining us from? We'll be having a Q&A session in the second part of this hour and would love to hear from all of you. So please type any questions you have for our panelists in the Q&A box. We will try to get through as many of them as possible, but please do put them in. If we can't get through them here, we will reach back out. We will circle back to you. But please put your questions and your comments in the box. And with that, I'd like to pass it off to our moderator this evening, Christian Nunez, partner, sister, activist, sister Black feminist, and president of the National Organization for Women.
Thank you so much, Farah. So as we are rapidly approaching nearly 1 year since COVID-19 disrupted the world and disrupted our lives, the pandemic has pulled back the curtain and shone an even brighter spotlight on the entrenched social and economic inequalities, particularly for Black women of color, Latinx, trans, gender non-conforming, and immigrant populations. While these communities were and continue to be overrepresented in industries that were hardest hit by the pandemic and faced deepest repercussions, the lasting impacts on women in general will affect us now and on for generations. This incoming administration in the White House has made an impact and made a commitment to tackle the COVID-19 among their top priorities. So today we're excited to be joined by two experts in public health and policy to discuss how we best can move forward to provide an equitable care to all communities that have been faced by the COVID-19, particularly the impact on women. So we're really excited to have Ms. Fatima Goss-Graves, who has served in numerous roles at the National Women's Law Center for more than a decade and has a distinguished track record working across a broad set of issues central to women's lives, including income security, health and reproductive rights, education access, and workplace justice. She is among the co-founders of the Time Up's Legal Defense Fund, which connects those who experience with sexual misconduct, including assault, harassment, abuse, and related retaliation in the workplace, or in trying to advance their careers with legal and public relations assistance. We are also very happy to have Ms. Lisa J. Pino, who is an attorney, public service executive, and former Obama appointee, and national security official. Her experience includes serving as a Biden-Harris USDA Agency Review Team transition member and a senior counsel to Secretary J.C. Johnston of the Department of Homeland Security, DHS, on crisis management, pandemic, immigration, cybersecurity, and business affairs. She is a former community organizer and an immigration advocate and has dedicated her career to ending poverty and creating opportunities for low-income children, individuals, women, and families of diverse backgrounds. And prior to her federal service, she worked in Arizona as a staff attorney for migrant farm workers and affordable housing advocate for predatory lending victims. She is currently the executive deputy commissioner at the New York State Department of Health, where she is focused in the COVID-19 operations response for 19.5 million New Yorkers. So we thank them for coming, and we will begin our questions with Ms. Lisa. So Ms. Lisa, thank you for being here today. And can you give us some context on how COVID, so basically how your experiences and how COVID has impacted everyone, and how you feel like this experience has impacted people, the year-long history of the situation that we've seen so far.
Thank you, Christian. Well, first, I just want to say thank you for the honor of joining such an important topic. Thank you, Farah, Monique, Fatima, all of the incredible women that are listening in. You know, I've spoken often about COVID and the impact of communities of color just in public health before COVID, but I have to say the first time that it's a circle of women. So this is really special. You know, I am sorry to say, I think we all know this, but the impact of COVID upon women has been devastating, absolutely devastating. And it's just, you know, not only have we turned the clock backwards so quickly, but we're also moving. You know, I keep saying about COVID that COVID has been the great disruptor, and it really has accelerated these ongoing trends in the economy and public health and education. Like, we've known all these systems have been broken for a long time, and what COVID has done is exposed all these ruptures. And here we are, and we have to take action. So, you know, it is basically, you know, we're almost at the one year anniversary of COVID, of when the first case landed in Seattle of that gentleman who flew from Wuhan into the United States. But, you know, just to get a snapshot of where we are today at almost at the end of January, we now have 100 million cases of COVID worldwide. I'll say that again, because it really, it's difficult to process. 100 million cases worldwide and counting. We have recovered now almost more than half, rather, we've recovered more than 55 million of those cases, which is remarkable. But we have 2.1 million deaths worldwide. And in the United States alone, we have 25.6 million cases as of today. And we have reached, we've crossed the 400,000 mark. We now have 429,000 deaths in the United States, in this great country. 430,000 deaths is just something a year ago none of us could have imagined. And as if that isn't enough, but you know, the impact of this virus, of this pandemic on women and women of color is even more formidable. So just a few statistics, and these are all from the CDC, but COVID cases. So COVID cases in the Black community are 1.4 times higher. In the Latinx immigrant community, 1.7 times higher. Hospitalizations, there's another sobering, jaw-dropping statistic. Hospitalizations for the Black community, Latinx community, Native American community, 4 times higher than the average population. How is that possible? 4 times higher. And the death rate, the mortality rate, again, across the Black community, Hispanic community, and Native Americans, 2.8 times higher mortality rate. So we have sobering work to do, you know, whether it's public health inequities or economic inequity. You know, it shouldn't surprise us that these data trends follow the same patterns, right? The question is, how can we galvanize this moment to really exercise action and power as women and demand the public health and economic support that we need that really is our right? So, you know, that's why it's so important. A dialogue like the one we're having this evening will educate, inform, and inspire all of us to do something about it.
Thank you, Lisa. And I think you bring up some great points, because one of the things that we continue to talk about is, and when we talk about intersectionality, we talk about oppression, is, you know, the extreme and disproportionate rates that we see in colorless community, marginalized groups. And as you just named, 4 times higher hospitalization, 4 times higher in diagnosis, 2.8 times higher mortality rates. And these are extreme, and you bring up a great point. But when we point to some things that we see happening in other countries, And sometimes countries that we feel, with our bias, we think would not be doing as well or would be as the United States, we see they're doing much better in their plan for care. We see Taiwan, Germany, New Zealand, Finland, Denmark have instituted better recovery plans in their countries to respond to COVID-19 for equitable recovery. And so we wonder, how can we galvanize? Like you just mentioned, like how do we galvanize? How do we protect our women, in particular our women of color, our TGNC women, our immigrant women? How do we come together as women to make sure we're protecting these women who are more at risk, more frontline workers, more essential workers, when we fail to sometimes look out and consider how COVID-19 has truly impacted the population of women, and particularly women of color, marginalized groups of women. Could you speak to that, please?
It is amazing because we are literally living through one of the most historic moments probably of our lifetimes. One of the reasons why this rupture of COVID was so devastating for the United States so quickly, there was a lack of federal leadership and coordination coming from Washington at the onset, because of course, what state or local county or what mayor can compete with the resources and infrastructure that the federal government has. We've sort of been catching up with that, and we're in the midst of a big transitional change from one administration to another. The Biden-Harris administration is about a week in. They have concentrated full force, especially the first 100 days. President Biden has committed 100 million vaccines in the first 100 million days. So we are, in my view, in the process of turning things around, and that hopefully this will be, fingers crossed, like the hardest part that we're going to see, that the worst is going to soon be behind us, right? But in terms of the impact of that, well, let's look at vaccines. That's a really great example. The vaccine distribution in the country really demonstrates how complicated and how interwoven we are right? So it's at the national level, the federal government, state government, governors, local county, your school board, your municipality. What that means is that every single action and all of our voices and statements do matter. And we have opportunities to raise them on the national platform, the state platform, at your local school board, at your place of work. We have numerous opportunities to exercise that voice and ability to demand better services, better programs, better benefit, better value. And I think that collectively we have to create almost like a diaspora of that. It can't just be at the national level. It can't just be, your neighborhood. Like we have to coordinate and synthesize what are the demands, what are the needs for women. And I think it's just messaging, right? It's like, so that we're all synchronized and that we support each other. So that if we're saying, for instance, we don't have that infrastructure of childcare around the country. We don't. How has this impacted me? Well, as a working mom, I've had to quit my job because I'm not able, to work and have childcare at the same time, right? But how can we elevate that to our elected officials at different levels, including the national at Washington? So I think it ironically presents us, Christian, with a lot of opportunities to get active. It's really a time like no excuses. We all have a way of engaging.
Thank you so much, Lisa. I'm going to move over to Fatima, and we're going to come back, and I'm going to ask some dialogue between you and Fatima. But I want to move a little bit more over to some of the policy. Fatima does a lot of work around policy and legislation. So Fatima, could you talk to us a little bit more about why women have been so disproportionately impacted by COVID-19?
Well, I should first say I'm just really also glad to be in conversation with you, Lisa and Christian and Farah. And so thank you guys for providing the space for this conversation. And And around the legislative front, and I'm sure we'll get to it, it feels really timely and urgent. So even better. There are several dynamics that are happening all at once that are creating a perfect storm, right? You have women are both more likely, especially Black and Latino women, to be frontline workers and have been working in many cases without necessary safety conditions, and certainly without the premium pay for working during this pandemic on the front lines. About 1 in 3 Black women who are working as essential workers, just to provide some perspective. At the same time, women were disproportionately losing jobs during this pandemic. And some of it, as Lisa and you have named, is due to longstanding job segregation around the sorts of jobs that are already more precarious, where women were more likely to work. And so, that's why you saw those shocking numbers. It was a combination of things in December, which sort of blew people away. The idea that the job loss numbers in December were really due to really disproportionate job losses among Black and Latina women. And some of that is that this pandemic revealed how truly fragile our care system is. Going into the pandemic, if you had talked to anyone, they wouldn't say that childcare or long-term care was easy to find or affordable or especially stable in their city. People for many years have been talking about childcare deserts, the fact that they struggle to find high quality, affordable childcare anywhere near them. And so what we have had happen in this period is childcare centers shut because they didn't get immediate support. And those aren't just quickly reopening. It's not as if they took a week off and had a huge cushion of support to fall in. Those are sort of the barest of small businesses that run on very thin margins. And childcare workers, who are disproportionately women of color and disproportionately paid low wages already, didn't have a cushion to fall back on when their jobs went away overnight. And all of that meant was that the invisible, unpaid caregiving work that women have long disproportionately bared, unnoticed, unmeasured, that the demand was to work, and in some cases to homeschool and to care for your children all at once, right? And it's not possible. So if there is a bright light of this period, it is about what's been made visible, right? That our care infrastructure is so fragile, that the long-standing occupational segregation and the paying of low wages of jobs that are women's jobs, and in part because they are women's jobs, that leaves people with no net. And that we have all sorts of language around workers who we used to just call low wage workers, and now we call essential workers. And so it provided a whole new framework for what's possible. And that leads me to if I could just make one last point, to the path ahead. Because the path ahead is the path that we have needed these many, many months. And it is the really meaningful and aggressive and serious rescue package that the Biden-Harris administration introduced, and that the Hill is sitting and grappling with in real time. And that is where you're going to see whether we have the sort of investment that brings a little relief to women in this country, or whether we leave people in a situation that gets worse and worse. It was really, I thought your point, Lisa, was sort of hopeful around, like, we have this dark time, but there's going to be a time where we're going to see something different, and the decisions we make today have everything to do with whether that forward-looking time is going to feel very different for everyone.
I think you bring up some great points, Fatima, and I think both you, Lisa, and you both say some interesting things, and that is what the pandemic did was it put a different look on what we used to consider some people and some workers. Before it was just kind of like, oh, they're low wage workers, and now it kind of made us look and revalue um, those same the same group of workers as essential because they are the what help keep us going, keep running our country for so long. So hopefully from that process, it brought some light to recognize some of the struggles that women have been going through. Like we talked about, childcare has always been a fragile issue. Childcare has never been sustainable or available to the resource that women have always needed. It's always been an ongoing issue. We've been always fighting for, full access childcare and free childcare. These are things that women have always been struggling with, which is the battle. So, and hoping as we go through this, we'll see that it'll be with the COVID package and the relief packages coming up, we'll start seeing that maybe we'll start questioning the value. But I think it also brings up some other points that have happened too, that women are being more exposed to. And I want to talk about this too, because we also know COVID also brought up some other vulnerabilities that women experience, and that's sexual violence and intimate partner violence, right? So we know that through COVID and the quarantine, women became at risk for increased risk of sexual violence and intimate partner violence, being at home and being forced in quarantine with their abusers. And through the use of the dangerous places with their abusers, some things that we hardly ever talk about. I want us to talk a little bit about that. How have we kind of swept that under the rug? How have we neglected to talk about the importance of the impact of COVID and how it's affected women when they've had to be at home and had less protection from, intimate partner violence and sexual violence because of the pandemic? Fatima?
So, I mean, some of it is exactly what you have said around, when in the early days of the pandemic, when the advice was stay at home for safety, the early messaging had very little consideration around whether or not it was safe for everyone to be at home. And so the first thing I want to say is that that was a public health and policymaker mistake not to have on purpose embedded that in the early messaging. And what we saw was no surprise is that the rates that people who the rates of people who reported being in danger, unsafe, skyrocketed, and the resources weren't there for the organizations that are built to respond to gender-based violence crises. And so there was a little bit of those groups actually needed more and had less at a time where they were overwhelmed. And over many, many months, we have seen what I would call sort of a scrambling in the private sector to try to make up for it. And philanthropy is not going to match the ability of the federal government to resource a crisis at hand. So, this year people have talked about the many overlapping crises that we face, right? They've talked about the crisis of a global pandemic, the crisis of which was a health crisis, an economic crisis. They talk about the visibility into the longstanding crisis of racial inequity in this country. Sometimes the childcare crisis, if it's named really specifically, but very little attention to the crisis of violence and violence at home. And so, I think about the time we lost, frankly, over the last year without having national leadership to fill that in. But I also think about what's possible with the Biden-Harris administration, and the president has made very clear that this is a big priority. And so you see it reflected in the rescue package. I suspect we will see it and a significant investment reflected in his first budget. People are expecting that, and there's wide opportunity to do that. And hopefully we will also see it in the reauthorization of the Violence Against Women Act. And so, you know, this has felt like a long week. It is sometimes hard to believe that we're only a week out basically from Inauguration Day, where people were, you know, dressed up in pearls and all that. But the job of all of us and all the folks on this webinar, I'm sure, is to get to work and to continue to make visible this problem so that it does end up where there is policymaking opportunity.
So this question is for either one of you. Considering that we see that the Biden administration has definitely put some things in place, to really make sure they're addressing women and gender, racial equity. What would be your recommendation or strategies to make sure that everything is done from a racial equity lens? Because one, we already have a beautiful start because we have the most diverse cabinet, right? And we have a woman of color as our Madam Vice President. So we're seeing like first that we've ever seen. But I think that what we also seen from COVID-19 and what we're talking about today, even within the impact on women, is that we're seeing that majority of the extreme impact and extreme disadvantage has been on women of color and marginalized groups of women. So we really want to make sure that whatever strategies and policies and legislation is going forth is truly coming from a lens of racial inequity, racial equity. So because that's really the populations that are most affected. Even when we talk about vaccine distribution, right? We already know that a lot of people, how it's trickled down. It's like the communities that are most impacted, the communities that are the ones that need it the most, are having the higher rates of infection, higher rates of hospitalization, are some of the communities that are going to get that are ones getting those vaccines the last. So what are your all suggestions to make sure that as we move forward, we're seeing this is coming from a place of intersectionality, racial inclusion, racial equity, and strategies and legislation?
The Biden-Harris administration has been extraordinarily clear that racial equity is at the core of what they will do in terms of organizing the government and policymaking. If you look at the racial equity executive orders that they released this week, I mean, it is probably the loudest signal we have seen in the early days of the presidency, just full stop. But the thing that I would just say, which I think is a little harder, and that is the thing and a point of advocacy going forward for us at least, is that it will be their challenge to ensure that their racial equity framework always includes gender, just from the beginning, and that their gender equity framework always includes a racial analysis. And so, and in part because it's just siloed people doing different things, and so how you connect it. And so a good example, and you may have seen today that they announced 2 executive orders related to reproductive health. And both of them were important and would make a really big difference. They're basically getting rid of the global gag rule and really what has amounted to a domestic gag rule, instructing the Department of Health to do the same. But if you looked at the responses from organizations around the country, especially in the reproductive justice movement, what they have said is, we think it is more critical for you to do that but also continue to launch us forward. And so what you will see as a racial equity issue, a demand that, for example, in the president's first budget, that we do not see the longstanding discriminatory Hyde Amendment, which has meant that you can't spend federal funding on access to abortion care. And so I think they will be pushed, and lots of people say accountability is love. Isn't that the saying? With love around ensuring that things that disproportionately affect Black and brown women are at the center of a racial equity agenda as well.
I would add, I do have confidence to echo Fatima's comments. The 4 core tenets of the Biden-Harris administration are climate, economy, racial justice, and of course, COVID. Just in terms of the representation of nominees and new administration officials, it is one that truly better reflects the diversity of who we are. And, being a former member of the Obama administration and remembering how heavily and seriously dedicated we were to community engagement, and how one of the first offices was the Office of Public Engagement that President Biden and Vice President Harris stood up. I do have confidence that they are doing everything that they can, and they're really moving at the speed of light. I mean, it's not traditional for an administration to be moving so quickly, but they have a clear view. And, in terms of what other opportunities there are, I think the big challenge for this administration will be you can move swiftly by executive order and sort of like reverse the harms of the prior administration. But what is much more challenging are the much needed and more sustainable institutional vehicles like regulatory change and, of course, statutory change, right? Like the Equal Rights Amendment, or being able to propel a higher living wage. I mean, the minimum wage has just been, the cost of living for women of color, for all women, but especially for women of color, like no one can sustain, at a minimum wage, living, working 1 job, working 2 jobs. That's, poverty is a core reason why these systemic barriers keep taking place. But, for the Biden-Harris administration, yes, you can move very quickly, literally the stroke of a pen, an executive order. But how will the regulatory and legislative framework, despite having that 50-50 in the Senate, it's still going to be a challenge. And we have to think about what those policy and statutory solutions are going to be. And I just want to give a couple of statistics to echo Fatima's excellent commentary, because I think it crystallizes how much work there is and how important every day is. But we have lost, just in COVID, the estimate is, because of the sacrifices that women have had to make in the workforce, we have lost $64.5 billion lost in wages and economic activity. Almost, $65 billion. And guess what? Women have had to drop out of the labor force at a rate of 4 times higher than men. 4 times. 865,000 women have had to leave work, whereas 216,000 men have been in that position. So that's another eye-opening reveal. So, what better protections can women have for job security, better living wage, healthcare, education? We've been talking about this for decades, but this should be the opportunity to reverse it, not just for the next 4 years, but beyond.
Thank you very much, Lisa. Well, we just want to thank you both for your expertise and your insight. We want to take a time now to really open it up to our guests and participants to ask questions and just hear firsthand as well from their own personal experiences. So we're going to have Carlo, part of the NOW team, help provide us some questions from the audience. So Carlo, would you like to tell us our first. And just a reminder, we ask that you all participants say your name and where you're from and with your question, or just share your experience so we can read them in. So Carla, would you go ahead and just provide us with the first question you have for our panelists? And Vera, also please feel free to jump in as well.
Thank you, Christian. The first question is from Doris Jean Ann Huroff from Pelican Rapids, Minnesota. She says that Tina Smith, who represents me in Washington, just reminded me that raising the minimum wage is absolutely overdue and one very important item that we must lobby on Biden's plan. How would it help, and how high does it really need to get to help people be self-supporting?
I mean, it's $15 is the number that is both in the Raise the Wage Act and a part of the $15 an hour and a part of the bill, the rescue bill that Congress is considering now. I will say everyone should stay tuned for a fight over the next couple of weeks, because I don't want to get into the very weedy and boring procedural mechanisms, but there will be a fight over whether or not things like a federal minimum wage at $15 an hour and a federal permanent paid family and medical leave plan can be considered as a part of this rescue package. And what we know is that part of what is happening is the fact that women are disproportionately those making minimum wage. And for many states, the federal minimum wage is the only minimum wage. And for many other states, there hasn't been any meaningful raise for people in those jobs in well over a decade. So it is both past time. It is extremely popular in states around the country and when people are interviewed directly. And so really the question is whether politicians are going to get in the way of doing this important thing that would put dollars in families' pockets right away.
Lisa, would you like to comment or? All right, thanks. Carla, next question.
Thank you, Christian. The next question is from Kim Brandon from Brooklyn, New York. She says, when we look at the death of Dr. Susan Moore and the medical apartheid she experienced as a COVID patient, can you talk to bias and racism in our hospitals, and what, if anything, we can do to maintain, fight for each other's humanity in hospital settings?
Let's speak to that. I think, in New York, for instance, Governor Cuomo and the administration for the state is looking really hard at how to, we have like a task force, and we're doing research and studies to see how we can break these systemic, the systemic treatment of women of color in the medical field. But I think it will have to be an issue that really states and localities have to address, whether it's like one hospital administration at a time, but how the Biden-Harris administration could leverage the importance of this issue, because, even before COVID, women, Black women and Hispanic, Latinx women were experiencing these types of patterns in their care, right? So like women who are pregnant, women who are going to give birth in the hospital, like this is pre-COVID. So being able to have research and findings and concrete study of why the systemic discrimination is taking place, but also being very specific about the level of care. Is it that part of that discrimination is playing a role with the level of care that women are receiving at the hospital? The statistics quoted earlier about hospitalization rates, about mortality rates, it's yet to be determined. But those hard questions have to be asked, because what we've seen in maternal health, for instance, is that there are disproportionate impacts and severe gaps for women of color. And is COVID just replicating those patterns? So, here in New York, at the state level, we're exploring that, but that could be an opportunity again for the Biden-Harris administration to see how they can fold in that type of equity within coverage for COVID. And that is a practice, that other governors, other mayors, institutions, hospitals, CEO, administration, or even associations, for physicians or nurses, et cetera, be able to, demand and compel that those gaps and inequitable treatment becomes a priority. So it's not just about, making sure that there are enough beds in the hospital, enough PPE, enough vaccine, but making sure that everyone receives the same level of care. That must be a top priority going forward.
Thank you, Lisa. Carlo, we could probably take 2 more questions and then we're going to, so next question, please.
All right, this next one comes to us from Allison Beckringer, also from Brooklyn. She says, I'm curious about the second and older effects of COVID on women's health. For example, I was reading about how Pap smears and preventative screenings went down by a lot in 2020. Could the panelists speak to what's on the horizon? What should we be looking out for when it comes to women's health?
I think we're right to be very worried about that. I think I would also add very worried about mental health, and both the short-term and long-term effects of COVID is unknown. And that's one of the reasons why part of our task is over the next year, really clearly reminding ourselves of the story of what has happened so that the policy solutions really bake it in and the public education campaigns do as well. And so it means that, one of the important things that happened today on Health Executive Order Day was making it easier for people to get insurance again as a part of the Affordable Care Act, which and expanding access to Medicaid. And so ensuring that people have continued and sustained access to healthcare, not just COVID-related conditions, but sustained access to care is going to be a thing that's important for the care people have missed this last year, but the many unknowns around the long-term effects of COVID that may show up in a range of different ways.
I think the challenge, is that the impact of COVID isn't just for this year. It's already been a year, 2020. We've just embarked on a new year, but we can't even say that a year from now, it will all be over, more likely this is our new normal. And the challenge is, again, as mentioned, 865,000 women alone that had to drop out of the labor force, in addition to the millions of women that have lost their jobs and who've relied upon their employment for just basic health care. The perfect storm and challenge is that you have millions of women who are less able to afford the healthcare that they need at the same time that the system is more taxed and drained. Most hospitals across the country and most clinicians are swamped dealing with COVID. Bed capacity, surge capacity has had an impact on something like being able to go for your annual PAP and your annual checkup, right? And then the availability has, just the geographic availability has narrowed as, clinics or physicians or the doctor's offices are like retrofitting for vaccine distribution. So it could not be more challenging. And so women, again, women of color who, historically are more vulnerable, who are often, sometimes less likely to go, less likely to be able to afford it. Now it's even a greater risk to their health. Because they have less access, less affordability, less opportunity. So, it could be that a year or two from now, we are going to see, like a mental health barrage and also a physical health. Like if you don't get, for instance, your mammogram that you were supposed to, or you don't get, your annual exam, what does that mean? What do you find out a year from now or two when you're able to go? I think that we are living in a precarious time, and part of the value of having a conversation like we are this evening is being able to provide resources, information, and also inspire and just provide that emotional support to each other, that this is important, and whatever we need to do as a community of women, that we will be there for each other to get through. But there's no, even though we're getting vaccinations, and this new administration, I believe, is going to help us, it is still going to be a long haul.
Absolutely. Thank you very much, Lisa. Okay. So thank you very much. I'm going to turn it over now to Farah. So Farah, I'm going to turn it over to you.
Absolutely. Thank you all so much for this incredible panel and this conversation that just really resonates, I think, on so many levels for so many of us, in particular, those of us doing the work of gender justice at the intersection of racial justice, right? Those of us doing the work of health equity, right? At the intersection of sexual violence, right? The intersection of survivorship, and the intersection of mental health, right? And innovating and providing services, both in our brick and mortar spaces, which many of us have had to go back to, as well as online via telehealth. So, I think that the last thing that I would say before closing and thanking you all again for participating is that what's been highlighted here is that the recent inequalities, the recent inequities exposed by the COVID-19 pandemic and the racial uprisings, let's not forget that, against white supremacy, racial justice uprisings, actually, against white supremacy, have really underscored, and they continue to underscore for us, the need for bold strategies, right? For services, for policy, as we talked about here, for practice models that interrupt cycles of gross discrimination, community neglect, disempowerment, and just really what most of us are describing as personal, social, and really the last 4 years of a political catastrophe. These times have really amplified for us the need for bold moves, bold action, and a need to restore forward beyond voice, beyond language, and yes, beyond this conversation, right? Because once this closes, what do you do then? Beyond protest, beyond voting into office new political leaders, it's going to take us. We have to play our part in the next year, in the next 4 years, and beyond. Because now more than ever, the struggle for health equity has become about our survival. It is about our survival, as our panelists so articulated. And it is also about mobilizing community-led advocacy for integrating gender violence within racial justice frameworks. I'm really so glad that we're able to be in conversation not only about what the issues are now, but what it is that we can forecast that they will be. I'm glad we're having conversations about what's being done now by this new administration, but also I'm glad that we're already thinking about what we can continue and what the administration should continue to consider, how we can continue to consider what our own work is, as we saw in the chat, people talking about or what our own work is, what they themselves can do. That continues to be central, and we continue to foreground this idea that we all need to be involved, and we invite you to be involved with us at Black Women's Blueprint and be involved with the National Organization for Women in this work. And lastly, I want to first thank, I have just to really give props and just, uplift our ASL translator, Vanessa Martinez from RGC Access, for their tremendous work of translating this panel for community. We will have ASL for all of our following panels, all of our following conversations. I want to thank our panelists, Fatima Gosgraves and Lisa Pino, and our partners at Now, Christian Nunez and her supporting team, and also our supporting team at Black Women's Blueprint. We thank you so much for all the work that you've put into this on the back end. I saw in the chat that folks are asking for resources as well. Please, I'm speaking to our team, let's save the chat so that we can circle back and give you those resources. And so we can circle back and continue to be in conversation with you and give you some of the answers if we can, or be in co-creation together about what solutions can be to some of the questions and some of the, statements and what you've posited there. So thank you all so much.
Thank you so much. Have a great evening.
Have a great evening, everyone.
Thank you so much.